Welcome to Core Competency Domain 4, Teams and Teamwork. The purpose of interprofessional education is to help students learn how to work as part of an effective interprofessional collaborative healthcare team. In 2011, the Interprofessional Education Collaborative, also known as IPEC, released 4 interrelated core competency domains for interprofessional education. These interprofessional education competencies were developed to better prepare health profession students to deliberately work together to meet the common goal of delivering high-quality, safe, patient-centered healthcare. This video will be addressing the 4th competency domain, which is to apply relationship-building values and the principles of team dynamics to perform effectively in different team roles to plan and deliver patient, population-centered care that is safe, timely, efficient, effective, and equitable. At the end of this training video, you'll be asked a short series of questions about this competency to help assess your understanding of the competency presented. Let's talk to our healthcare team from the scenario in this video series to learn about how this competency domain can be applied. Remember, each healthcare team will be unique with different professions based on the context and type of care delivered. As with previous videos in the series, this scenario centers around Ella, a 78-year-old woman who, in collaboration with her healthcare team, had decided to stop curative-directed oncology treatments and transition solely to palliative medicine and symptom management and control. Ella has been working with her interprofessional collaborative team for 2 years. In addition to Ella, our patient and her daughter Karen, there is Dr. Young, the oncologist who specializes in breast cancer. Jose, the oncology clinical nurse specialist and advanced practice nurse who works with cancer patients to manage symptoms. Andrea, the oncology social worker with advanced training in palliative care and psychosocial oncology, and Dr. Lee, the oncology pharmacist with experience in palliative care. If you haven't watched the previous videos in this series, additional description of the different health provider roles are discussed in greater detail in video 2, and the other interprofessional collaborative practice competencies are addressed using this scenario. The healthcare team has a pharmacy student who's being precepted by Dr. Lee and is joining the group today. The team is taking some time out of their very busy schedule to explain to the student about how they function as a team and how that has developed over time.
This is my student intern for the semester, Marie Lopez. I thought maybe we could talk to her about interprofessional teamwork.
I really appreciate the opportunity to learn more about teamwork from you.
I think we work well together. We've been together at least 2 years now. There are many kinds of teams in healthcare. Some have a lot of team member transition or only come together on a short-term basis. This is one of the reasons why developing your personal teamwork skills is so important. No matter where you work or what kind of team you're on, your personal teamwork skills are an asset. Every team's going to have its own set of communication styles or even relationships. I found that the Team Steps training serves as a very good basis for teamwork.
One of the most important things in working as part of a team is to understand our common purpose. When everyone focuses on working together to meet the needs we've talked about with our patients and their families as we plan care and make decisions, we can discuss complex and even conflicting ideas more effectively. And we work hard to maintain open communication. That is so essential to help us bring our diverse professional ideas into planning and providing care. It helps when we disagree too. Rather than competing with each other about who is right, we realize we each have a piece of the bigger picture.
Also, when you have a team, you don't have to do everything yourself. It helps you be more efficient to do the things that you are best at, and then to know that other aspects of care are being well taken care of by other team members. We work together to understand which member of the team might be best suited for which care task.
Yeah, I agree with Dr. Young. Collaborative interprofessional practice is different than just delegating various components of care to different members of health professions or even talking amongst ourselves. With collaborative practice, we share accountability for the patient's care. In a recent palliative care case, we worked together to help a patient achieve the goals she identified for symptom management. We literally shared in the goals and outcomes of care.
So how did you all develop into the team you are today?
Well, we had just started working together. Andrea and I had been here a few years, and Dr. Young had just come on board and hired Jose as the clinical nurse specialist, which is one of the advanced practice nursing roles. You You see, we had a really complex patient where we had to focus on working together to come up with a good plan of care. We had differing perspectives on what was needed, but we felt that talking out loud about our ideas helped us develop a stronger plan for the patient. You know, it was a really satisfying experience, and we had such great outcomes, right?
And we decided that intentionally working as a team could improve our care, not just for this one patient, but for all of our patients.
So we started with a one-day retreat where we focused on some team building exercises, and we scheduled a weekly team meeting where we laid out some general rules.
Like what?
Like sharing leadership during the meetings, we rotate who runs the meetings, but we also use a timed agenda because we have so much to talk about in the limited time. And we also had some important discussions about what ethical principles we could use to guide our teamwork. In the beginning, we agreed that we would each take a turn at sharing our ideas about what we thought was going on and what was needed. We found that we had to overcome the natural hierarchy of healthcare, and we had to be intentional about sharing power and respecting each other. Now, each of us feels comfortable about speaking up, and we each have something to say. We also speak up anytime and not just during meetings because we realize that we need to be looking out for each other all the time.
We spent a lot of time learning about each other's roles and learning to listen to each other. Also, we routinely review our team performance, which includes how we perform together as well as individually. It takes a lot of trust to do this, and we've built that with each other over time. We've built our own, what they call psychologically safe space together. We use what we learn in our review to help build our teamwork. Also, we do a quick debrief at the end of each meeting to see if we accomplished what we needed to in the meeting or how to improve the meeting process as well as our work together. But also, we review our performance at a quarterly review meeting where we pay close attention to our outcomes.
That's right. We're going to do a retreat for the quarterly review meeting this year at my house, complete with backyard barbecue and swimming.
Yes.
It helps to get to know each other in a less pressured situation.
Wow. I want to be on a team like this when I graduate. You all seem to get along so well.
Well, we work at it, but it's not always easy. Sometimes we disagree about a plan of action, and sometimes we have a bad day and say things more harshly than we intend to.
But because we have a good foundation for communication, we can talk about that too. One of our intentional team development activities was to participate in team steps training and practice using some of the techniques like debriefing and huddles to improve our communication.
Even so, I think the trust that we have built in each other and reaching our common goal has helped get us through.
Yeah, so that and Andrea's expertise in conflict management and communication.
And we really do try to keep the patient and family at the center of everything that we do. You want to remember that the patient and the family are a part of the team.
Right. You see, the whole point of our interprofessional collaborative care is that our outcomes and our solutions tend to be better since we all come from different perspectives and strengths based on different professions and experiences.
This is Interprofessional Competency 4. Apply relationship building values and the principles of team dynamics to perform effectively in different team roles to plan and deliver patient, population-centered care that is safe, timely, efficient, effective, and equitable. Let's examine what subcompetencies we saw illustrated in the conversation with the student intern about the teamwork that the healthcare team has worked hard to establish and maintain. When we look at the specific teams and teamwork subcompetency, in subcompetency 1, describe the process of team development and the roles and practices of effective team. In this scenario, the team has been working together for 2 years. They've had a very positive experience working as a team and deliberately decided to further develop as a team, starting out with a retreat that included team building exercises and developing guidelines that help improve becoming an effective team. Part of the team development also included learning about each other's roles. The process of developing as a team included the subcompetencies of Teams and Teamwork 8, reflect on individual and team performance for individual as well as team performance improvement. Subcompetency Teams and Teamwork 9, use process improvement strategies to increase the effectiveness of interprofessional teamwork and team-based care. And subcompetency Teams and Teamwork 10, use available evidence to inform effective teamwork and team-based practices. This team used process improvement strategies like quick debriefs at the end of meetings and quarterly reviews to increase their effectiveness. Building in these systematic ways to reflect on individual and team performance provides for continuous quality improvement and is supported by evidence. As additional research evidence about what contributes to effective teams becomes available, these evidence-based strategies should be evaluated for potential use within teams. The next subcompetency is Team and Teamwork 2. Develop consensus on the ethical principles to guide all aspects of patient care and teamwork. Dr. Young indicated that the team discussed what ethical principles would guide their teamwork, demonstrating the development of a consensus on the ethical principles used to guide the patient care and teamwork. Consensus cannot be reached without a dialogue on the topic with the entire team involved. Again, interprofessional ethics related to healthcare teams is an emerging area as traditional ethical principles and professional codes of ethics need to be re-examined to determine application to interprofessional collaborative practice. For subcompetencies 3 and 7, address the nature of interprofessional collaborative practice, which includes both patient-centered problem-solving and shared accountability. Subcompetency 3 is engage other health professions appropriate to the specific care situation in shared patient-centered problem-solving. Dr. Lee indicated that working together and talking about their differing perspectives on care helps develop a stronger plan for the patient, which demonstrates shared patient-centered problem-solving. Each specific care situation will dictate which health professionals should be engaged in sharing patient-centered problem-solving to maximize outcomes. Paired with shared patient-centered problem-solving is shared accountability. Subcompetency Team and Teamwork 7 is shared accountability with other professions, patients, and communities for outcomes relevant to prevention and healthcare. As Jose, the clinical nurse specialist, pointed out, true collaborative practice requires shared accountability. In this team, the shared accountability comes from the shared common goals and the patient-centered problem solving. In subcompetency Teams and Teamwork 5, apply leadership practices that support collaborative practice and team effectiveness. This specific team has decided on a shared leadership model for team meetings and rotates who runs the meetings. This type of leadership supports collaborative practice, which includes common goals and shared accountability. Any one of the healthcare professionals on this team has the skills to run a team meeting. By taking turns, the team acknowledges that there is a sharing of power and accountability, which conveys respect for team members. Overcoming the traditional hierarchies inherent in healthcare can augment teamwork, but it may require deliberate strategies in order to successfully shift to a more non-hierarchical structure. For subcompetency Teams and Teamwork 4, integrate the knowledge and experience of other professions appropriate to the specific care situation to inform care decisions while respecting patient and community values and priorities and preferences for care. Jose, the clinical nurse specialist, reminds us at the end of the discussion that the patient and family are part of the team and the center of the care. Their priorities and preferences will be an integral part in the decision making. Andrea, the social worker, highlighted the benefit of bringing the diverse perspectives from the different professions to planning patient care. You can see the overlap with the professional communication competency here. You need good communication skills so that everyone understands the different perspectives that inform decision-making and communicates these perspectives in a respectful way. For subcompetency Teams and Teamwork 6, engage self and others to constructively manage disagreements about values, roles, goals, and actions that arise among healthcare professionals and with patients and families. Dr. Young acknowledged that disagreements inevitably arise about a course of action and that how things are sometimes said can contribute to these disagreements. Constructive management of disagreements in this team is handled by discussing the issues as they arise. At least one of the team members, in this case Andrea, has formal training in conflict management, which further helps the team to manage disagreements. It is important to note that sometimes disagreements can be constructive by providing the impetus for developing new and sometimes better solutions that arise out of the disagreements. For subcompetency Teams and Teamwork 11, perform effectively on teams and in different team roles in a variety of settings. Jose, the clinical nurse specialist, clarifies the importance of developing personal teamwork skills since teams change based on context and setting. So some teams will develop over time, and other teams are thrown together for a short period of time due to necessity. By being prepared to perform effectively on a team and in different roles, you will be able to maximize the outcomes for that team regardless of context or setting. Team STEPS, which stands for Team Strategies and Tools to Enhance Performance and Patient Safety, is a national evidence-based teamwork system to improve communication and teamwork skills among healthcare professionals. Team STEPS training is one way to enhance your teamwork skills. The IPE competencies can be accessed at the website on your screen. For further information about Team STEPS, that can be found at the website also on your screen.